Good morning. Welcome back. Well, it's called SAD, seasonal affective disorder. It's something we hear of every year around this time, and it's something that might be affecting you a little more than you might think. Tom Ledoux from Gunderson Health System is joining us this morning to discuss SAD. Now, Tom, this is something we hear about every year around this time, but give us a refresher. What is it?
So seasonal affective disorder, or the winter depression, is a recurrent annual depression that starts around the late autumn months and extends into the winter, with usually a reprieve in symptoms by the springtime. So we see low depressed mood, low motivation, difficult finding pleasure in things that you typically found pleasurable, sleeping more than we typically do, not going outside, not engaging in our typical routine, and maybe more negative thoughts.
Yeah, obviously the cold and not seeing the sun as much can affect this too, but is it more so common with adults? Can kids have this? If your child is saying, I feel this way, should that be something else that we're looking at?
So one of the hallmarks of depression can be a break in routine and not doing things that we typically find meaningful in our life. And children, as well as adults, thrive on routine, getting out of the homes.
No, go ahead. Sorry.
I think it affects both adults and children, children especially with their routine.
So about how common is SAD, would you say? I guess percentage-wise, if you had to guess, how prevalent is it in our area?
I know worldwide it's about 10%, and it affects many people in more of the northern latitudes. So around this state, it's quite often.
Yeah, pretty often. Tom, what are some ways quickly, that we can treat this? There's different types of, light therapy, different ways that we can kind of try to combat this.
So the three main components to treatment tend to be psychotherapy, light therapy, and medication for people who have an outstanding depressive disorder. So you have light boxes, light visors, and even daylight simulators. And with a light box, you can hold it anywhere from 12 inches to 18 inches away from your face. There's white light that goes directly through the retina that people typically use during the daytime. It helps increase their exposure to light.
Yeah, literally a light box that is helping simulate the sunlight can help. All right, Tom, we were running out of time. Thanks so much for being here. We appreciate it.
Thank you.